Hello, and welcome back to Gadfly City Live with me, Monica Cardenas. Don't forget to subscribe to Gadfly City on Substack and YouTube so you don't miss an episode. Today we have Meg Davis, a professor at the University of Warwick Centre for Interdisciplinary Methodologies, which she joined after launching the Digital Health and Rights Project. She's done years of human rights research across the world and led work to institutionalize human rights into the Global Fund to Fight AIDS, TB, and Malaria grant agreements in over 120 countries. She earned her MA and PhD at the University of Pennsylvania and held postdoc fellowships at Yale and UCLA. So welcome, Meg.
Thanks so much for having me, Monica.
Thank you for coming on. There's so much we can talk about in your career. But today, I think we're going to focus on your work at the Digital Health and Rights Project. Let's start with the basics. What is a digital health policy?
Sure. Thanks for asking. It's a great question. So, digital health is really a bucket term that we use to describe all the different types of tools and software and platforms we now use to access health information and services. And it could include like an app on your phone that you use to track your diet or your medication. It could include online portals you use to book appointments, or all the systems that we don't see that manage our health information. Policies are like strategies, laws, policies that govern how those things are designed, what happens with the data, and how they're used. So it's a whole new area of work for many people.
So that little checkbox at the bottom of the screen when you submit a request for a doctor's appointment or something like that, I assume that's part of the digital health.
Yes, it is. All the technologies, the platforms, it's a really expansive term. And I would just add human rights is, of course, a system of international laws and policies that uphold our right to human dignity, our right to privacy, non-discrimination,
Mhm.
and all those rights apply online just like they do offline.
How was it that you, first of all, I guess, can you tell us about the mission of the Digital Health and Rights Project and who you work with on that project?
Sure. The Digital Health and Rights Project is an international consortium. It includes researchers at universities, civil society, including health activists like HIV activists, digital rights and privacy activists, and networks of people living with HIV and affected by HIV. And we work especially in Colombia, Ghana, Kenya, and Vietnam, where we have national partners who are NGOs, civil society groups, or universities, and then community advisory teams made up of young people who are living with HIV or sex workers, LGBTQ, or young women, representing different areas of the countries. And all of those people together collaborate across borders to conduct participatory action research where the people being studied co-design the research and use it to develop their own plans for advocacy or for new programs.
So they get access to the results of those research programs rather than just being part of it and never seeing what comes out of it.
Exactly. Not only do they get the results, they help write the questions. In some cases, they lead the study discussions because they speak local languages and have the trust of diverse communities.
Mhm.
They've been involved in every stage of the process, from the first idea until we launch reports online.
And how was it that you first noticed these inequalities in the digital health among young people in the low and middle income countries that you named?
Well, because we're working with young people who are already subject to stigma and discrimination, and in some cases are criminalized. So, people living with HIV, sex workers, LGBTQ populations are criminalized in many countries and face all kinds of stigma and discrimination. So, for those communities, especially under new laws that are being passed that criminalize even sharing health information with queer people in Ghana, for example. These create inequalities in terms of who can access online health information and services. And then, if they get online, what kinds of experiences they have. Do they experience online abuse, hate, discrimination, or do they access information that they couldn't access from the formal health system? So there's both benefits and risks to what we call the digital transformation of health. And that's
Mm.
studied together.
And can you explain then how the participatory research programs, how they help overcome those inequalities, in addition, I guess, to just allowing them to help develop the plans?
What's really interesting, having worked with networks of people who are living with and affected by HIV, is how much when people learn something and share it with others, how that changes their position, their relationships in society, and it positions them as experts. So, in doing research as part of a participatory action research project, communities become the experts in their own issues. They become the authorities, and then they can brief governments, private sector, whoever, even other community members, and become a resource And so that
Mm.
changes the power dynamic and enables them to engage in advocacy and make change long after I might have moved on to another project. They're still there dealing with the realities.
Okay. So your own research, I noticed, explores the future of human rights and gender equality in the digital age. How does that research intersect with your work on the Digital Health and Rights Project?
It's really a direct spin-off from that work because it continued to be part of the Digital Health and Rights Project, even though we ran out of funding, but all the young people in the project said they wanted to continue. So the rest of us have been thinking about how we can support them, either with helping them with writing or with additional projects, looking for more funding. In my case, I'm working on a book on live wires, who are young people who become champions for health because they get online and get information and share it with other people who are not online. So I'm interested in people who are bridging what we call the digital gender divide. 9 out of 10 young women in Africa and Asia are not online, but those who do get online often become a bridge for others. So I'm interested in studying that. And also, I'm interested in looking at the new America First Global Health Strategy, which has been launched by the current US administration, and how that's affecting things like privacy and health data security in low and middle income countries.
Can you say a little more about that research, the America First?
Sure. So, as I'm sure in early 2025, the current administration ended USAID, suspended funding for health, exited the World Health Organization. And this started a seismic change in health and in cooperation on health across borders, especially for civil society groups who lost much of their funding. And now the US is promoting bilateral agreements signed with countries instead of working through things like the UN that bring many together. They're developing these bilateral deals in which countries get health aid in exchange for giving access to mines, mineral resources, or handing over all the sensitive health data to the US. It's really not clear what happens to that data when it gets to the US. Will HIPAA or other privacy laws protect that data? Will it protect people in Kenya or Ghana or other countries? So it's really unclear. So that's part of what we want to look at.
Mm. And I is it right to and
Overcoming
we're
the
back, we're back. Sorry for those technical difficulties, but I was asking Meg if the funding that, you said that you lost for the project you were working on, if
Mhm.
that funding cut was due to the changes the current administration made, or
Oh,
was it
no,
separate?
we just came to the end of our grant. So it's just
Okay,
part of the
okay.
normal reality of projects. You go from one grant to the next. So,
So we've recently heard from all corners of the internet that women are slower to use AI than men, and that we risk being, quote, left behind in the AI revolution. So, why do you think women are less likely to seize onto AI? And do you worry about how fast it's moving? I'm thinking about the advocacy, the medical advocacy that you were talking about in other countries where there's more limited internet access and how that might frame your ideas around AI use.
I think that's a great question. I'm so glad you asked that. I think we should acknowledge, first of all, that AI is complicated and we don't fully know yet what all the risks and benefits are. It's still developing quickly. But AI was not designed by women for women. Let's be honest about that too.
Mm.
There are very few women in high level roles, either as designers or as executives in big tech companies, and they're really lacking in diversity. And women also similarly get less education in science and technology. So we're less represented in those areas too. And we have more privacy concerns because we face often greater risks in terms of violence, and especially we know now about deep fakes and image based sexual abuse online. So it's a more complicated scenario for women. And in addition, there's all the environmental harms that we know AI is linked to, with growing protests against data centers in many countries. So I think it is good for women to engage with and learn about technology and AI because I think otherwise we risk having things designed without our voices and without our
Mm.
in. But I also think we should be calling for more robust, meaningful governance of AI and data that protects women's needs and make sure that it's an environment that's really safe and supportive for us, which currently it definitely is not for many. Demand better regulation, demand more robust governance of tech, demand access and demand a voice in the process. I think that's really crucial.
Have you been following the Trump administration's recent decision to they've said regulate the AI industry. I would hesitate I wouldn't call it a true regulation of the industry from what I've read about it, but do you think there's more to it than what the administration is calling for? I know that's a leading question, but I mean, based on what you just said is necessary, I think that what the administration is proposing is not
Look,
covering.
I think we all have indelibly burned into our brains that image from the inauguration of all the tech bros lined up behind the president as he was taking the oath of office. And I think nothing has changed. The most of global AI is housed in the US. It is under one legal jurisdiction, and the decisions that are made in the US have implications for the world. And I would say anyone, regardless of gender, who's concerned about this should pay attention and should exercise your vote and demand more robust regulation. I saw yesterday that Bernie Sanders had just called for a sovereign wealth fund paid out of AI stock, and I thought that was super innovative. And
Mhm.
creative and bold solutions are needed, and women should be part of that conversation.
For sure, yes. Is there anything that our viewers can do to help support your work, the Health and Human Rights Project
Oh,
Health
thanks
and
so much.
Rights Project?
I would say learning about the work, it's at digitalhealthandrights.com, following us on social media, on LinkedIn. I think we're on x.com and also Instagram. We're on all kinds of platforms. Young people in our project are producing podcasts. They're doing all kinds of communications work, zines, you name it. There's a lot to look at. There's a lot to read and learn and to share on. And I would also say to support local organizations wherever viewers are that promote human rights, digital rights, and a donation and makes a difference at this particular moment. So we need more stronger voices for digital rights in health and in everything.
Great, well, thank you. Thanks, Meg. We look forward to your book.
Thank you so much. It's been wonderful to chat with you.
Thanks everyone for watching, and don't forget to subscribe to Gadfly City on Substack and YouTube. Until next time, bye.